Thanks for watching Afternoon Live. According to the CDC, 51% of kids between the ages of 6 and 11 have cavities. Here with advice on how to stop the teeth brushing battle in your home, we welcome the author of If Your Mouth Could Talk, dentist Dr. Kami Haas. Thank you so much for joining us.
Yeah, thanks for having me.
Can you give us some insight into why this battle is so hard? Why do our kids just not want to brush their teeth?
I know I'm a dad myself, so brush your teeth, eat your vegetables, and do your homework. Right? These are the three things we always struggle with. With brushing, I think there's just a variety of reasons why kids sometimes don't do it. One is just it's boring usually, right? We want to make oral care fun, and they compare it to video games and TV and etc. The other one is sometimes they're overwhelmed with the sensation of the taste or the texture, the brushes itself, the sound of electric toothbrushes, things like that. The third thing is sometimes just a lack of education. As the kids get older, my kids are a little bit older, we want to teach them about why it's important to do it, so they're not just forced to do it, but they understand the value of doing it. And then, of course, as parents, many of us have negative associations with oral care. We hate the dentist, we're scared of the dentist, and we kind of provide that. Kids mimic what we think and what we say. There's consciously or subconsciously, so we've got to be careful what we do and be a good role model for our kids.
That's a great point. Do you have recommendations on when kids can be more independent with brushing and oral care? My kids are elementary and preschool age. They still need a little bit of help sometimes getting in the back and kind of learning how to floss.
Yeah, it's a great question. So a 5-year-old typically brushes only 50% of their teeth effectively. Even 11-year-old, my son is 12, they brush their teeth about 50% effectively. So parents, I think we need to supervise our kids much longer than we think. They do want to be independent, and we need to give them that independence, and we want them to feel like they're responsible. But we can have them, for example, be involved in picking the flavor of the toothpaste, picking their favorite toothbrush. But we as parents should be responsible for what type of toothpaste they use. Does it have fluoride? Does it have hydroxyapatite, et cetera, because otherwise kids really don't know what the ingredients are. And just like as parents, we learn about what's in our food, and we provide the right advice, and we provide the right foods at home. We want to do the same thing. We want to be at least knowledgeable about the basic ingredients that go in the toothpaste and the mouthwash, because 30% in average, we swallow our toothpaste and mouthwash. So it's really important, especially kids, because they haven't developed their swallowing reflexes. So it's really important that they have safe and effective oral care products.
That's a great point. Do you have other ideas to better motivate kids outside of, I guess, with fear? Because kids don't really understand the consequences fully, probably, of bad oral care, cavities, things like that. That's not really going to push them in the right direction to brush and floss twice a day.
100%. In fact, if you just use fear, then they're going to have anxiety. They're going to associate negative feelings about their oral health and taking care of their mouth. So we want to go positive. We want to tell them how it influences their self-confidence. We can talk about the freshening of the mouth, their peers, how they do in school. Kids with dental problems are actually 3 times more likely to miss school, 4 times more likely to miss get bad grades. It impacts sleep, nutrition. There's a lot of reasons, especially as the kids get older. If we educate them and we take the positive approach, they're going to behave better. Also, there's other few things. You can be more consistent. Do the routines always in the mornings before breakfast. That's another mistake that I see, not just kids, but a lot of parents. They brush their teeth after food because the mouth becomes acidic. You're not supposed to do that. And before bedtime. So that's one thing. Start early with little kids. You're supposed to start brushing a baby's tooth just when the baby teeth start coming in around 6 months of age. Make sure you use positive things. Again, use safe and effective products, not just for the teeth, but remember the oral microbiome is the billions of microbes in the mouth are evolving and maturing in kids. So there's a lot of things that we as parents need to take into consideration when it comes to oral care. And we need to obviously get the advice from our dentists and our trusted oral care products.
What about older kids heading into teenage years? Do you see kids reaching for more over-the-counter products, things like teeth whiteners? What should we know and be aware of for that age group?
That's another great question. Yes, as kids obviously get into the teenage years, they want to look better. They start doing a lot of at-home things. Sometimes some things are fine, but some things can be very dangerous. Like I've seen people do everything from teenagers, unfortunately, from like filing their teeth to get them straight, or use very, very potentially dangerous like peroxide-based bleaches. Overwhelmingly use it a lot, and over time that actually can damage the teeth, cause sensitivity. It can actually make the teeth duller and yellower over time. So as parents, even as adults, there are safer alternatives to whitening teeth, for example, for teens, even parents, like hydroxyapatite or nanohydroxyapatite is a very, very safe ingredient in toothpaste. That's also because it's kind of resurfaced the teeth. It's one of my favorite tooth whitening that's completely safe. Sodium bicarbonate, in other words, for baking soda, is another great ingredient in mouthwash and toothpaste if parents and teenagers want to make sure that they have white teeth, but also have a healthy mouth. The other one thing for teenagers, because they're starting to, have social life and, dating, etc. Bad breath is a good incentive for them, reducing it to use the right oral care products. And one thing that everybody misses, or most people do, is cleaning the tongue. Again, your mouth is more than teeth, so a tongue cleaner, a really good one with a specialized brush and scraper, is an ideal tool to clean the tongue, which is a really big source of bad breath.
That's a great point. Hey, thank you so much for your time. We really appreciate you chatting with us today.
Thanks for having me.
We'll have more information on our website at katu.com. We'll be right back with more Afternoon Live right after this.